Good evening. Today I have invited an esteemed guest whom I have known for last 24 years. He has motivated me to work so hard every day just so that I can afford his football shoes every month. Right, Parth?
Yes, that's true. That's true.
So, Parth, what are you doing now?
I'm pursuing MS Orthopaedics now.
Oh, wow, nice. So, do you have jitters or do you feel
Yes, definitely. I'm a little nervous about it because again, it's the first time, and we all know that the first year of residency is the worst. So yes, I'm a little nervous, but at the same time very excited because this is something I've always been wanting to do.
I remember like when you were giving in your 12th and it was mom and me, we both were discouraging you from taking MBBS and said, you don't become a doctor, don't be. But still, you were very motivated to become a doctor. Why was that?
So it was only firstly, I've always wanted to become a doctor since the eighth standard. It is only because I have seen the both of you work so hard and the amount of respect and gratitude that people have towards you. It was something that I've always looked up to, and it felt like, oh wow, this is the kind of respect. This is the kind of respect that I want to have, like the way people greet you.
Okay.
I want that kind of life for me. And apart from that, the social life, you guys are more social at this age than me, which although makes me jealous, but yes, I'm really looking forward to that later.
Oh, that's nice. So, Parth, are you happy with the current education system?
Um, I mean, for me, I think it was fine. I mean, I have no complaints against the current education system. I was given enough exposure to all the departments in the hospital for me to make a very sound decision as to what I want to do further. I was taught very well by the professors in my college, and the
Nice.
examinations that were held were conducted very well, so that which motivated me to study. So I don't have any issues against the current education system.
Yes, so I've seen that students who have just finished 12th, they go abroad for further studies. So, what is your basically take on that? What is the scope of medical students in abroad?
So for scope, there are a number of reasons why people choose abroad. It's not only related to the education per se. There are personal reasons. The kind of lifestyle people live here. It's a very busy life where throughout there is something or the other going on. You have your social obligations, and while abroad it is a little more relaxed. Even doctors are given the time limit. There are time limits to which doctors work. After a point, they are not obliged to talk to or
Right,
attend
right.
to any patients. But it's definitely not here. I've seen it firsthand with you that you get calls from late in the night to early mornings without even, and you are obliged to speak to them. You can't tell them it's not mera duty ho gaya hai or whatever.
Yeah,
So
true.
but that's not the case abroad. You are much more relaxed. Once you leave the clinic, that's it. That part of your life is over. But it's not the case here. Even after leaving the hospital, you still remain a doctor for most of your patients. So if people are looking for that kind of
Okay.
life, then definitely that. And yeah, definitely that there are monetary wise also, there are a lot of differences between the earning a doctor has here and there. So yeah, it plays a
But
role in the
if you
decision.
go to abroad, बर्तन भी धोना पड़ता है ना?
हाँ, बर्तन तो धोना पड़ेगा बिकॉज वहाँ जो वो आपका बर्तन धोएगी वो काफी ज्यादा पैसा मांगते हैं, और
Expensive.
वहाँ वो आप क्या निगोशिएट नहीं कर सकते.
So good. So you feel studying in India is also equally good?
Definitely, I would say studying in India is more helpful, at least for our profession, because we need to be in contact with patients as much as we can. And looking at the population of our country, I don't think we have a deficit in patients. And where I have completed my MBBS from a government hospital, and I can say for sure that we have much more patients as compared to doctors. Every bed in the hospital was full 24/7. So that kind of exposure for a student from the point of a student is very helpful. So I would suggest people to finish their MBBS or do their MBBS in India, irrespective of where they're planning to end up
And
in
even
life.
post graduation?
Post graduation, I personally feel that wherever you want to end up in life, suppose if you are looking to settle in the US for good, then I feel post graduation in the US is better, because you start learning as to how they operate, what the kind of protocols they follow. So if you go through
Okay.
go through that path,
System. You
you go
enter
through
the
that
system
system,
early,
then
so for that to
it's
better
for
to
you to
understand.
adapt to that kind of a system, it's better.
Okay. But I have always loved India, and I still feel that uh, I have always loved India, and I still feel that the exposure, the experience, which studying, doing post graduation, even super speciality, I still feel India is the best.
Yes, we have had this conversation at home, I remember.
Yes. So, as a father, it's always a proud moment when son steps into his shoes, And for me, obviously, I was very happy and elated when you were washed up with me for your first case with me. I was very happy. But what was your experience, or what was your thought process?
So the first surgery I remember is the fibroadenoma that we did
Yes,
together.
yes,
I remember while I was assisting you, you had told me that my hands are pretty steady for a surgeon.
true.
So which was actually the first time I realized that yes, I am destined towards surgery, or I think I can pursue the same
Yes.
thing. So it was a very memorable. I kind of want to say it was one of the most important moments, which is why I am here today and have I want to do MS
Decided to.
orthopedics
Oh,
आगे and take up
but I'm a
surgery.
surgeon and you're going for orthopedics.
We need variations, different kinds of doctors, different patients.
Okay,
You can
that's
help me, I
nice.
can help you.
Seriously, that's nice. So that brings to me to a next question, that once you become the orthopedic surgeon, and we will be getting old, and old people are very prone for fracture femurs or fractures. God forbid, if we have fracture, would you operate on us, or you will call someone else to operate on us?
It's not like this situation has not come in our life before. I have myself seen you operate on so many of our relatives. So I know for a fact that after working for so long, you can develop that kind of confidence. So I'm hoping that I can replicate the same and have that kind of confidence in me to operate on my relatives as well.
Sure.
Thank you.
Tathastu. You will have that confidence, don't worry.
So there's something that I really wanted to ask you.
Please.
So you're the first Dr. Bhagat in this family.
Yes.
So my inspiration has always been you and mom to enter this field. What has been your inspiration? How did you land up in this medical field?
So since childhood, I always as a dream to become a doctor. It was just that family physician whom we used to go, and they used to treat, and there are so many patients sitting next to them, and they would feel happy. And so that whole scenario of making people happy or taking them off pain has always inspired me to become a doctor. Me becoming a surgeon is a big shout out to Monica and Suhel, who are now in London. Monica is a surgeon, and she's always been my 6 month senior, and she's always called me wherever she's gone for the next post, and it's because of them I'm a surgeon today. So I'm a big shout out to Suhel and Monica.
And throughout this experience of yours of MBBS and
Yes.
surgery, what has been the most memorable moment or something that you'll never forget for the rest of your life?
So I think around 7 8 years ago, there was a young boy around 30 years old who had come with a perforated appendix with septicemia and all those things, and we had operated him. And then uh, his father, who's probably around 60 65 year old, okay, was so grateful. He touched my feet and all. Now that gratitude in the eyes of the patient, means it's like the blessings they are showering on you, like seriously, that feeling no money can buy, and that is really so satisfying. It's not comparable to anything.
Yeah, I know. I have been a witness to that because outside one of the OTs, I remember you were explaining to a relative as to how the surgery went, and they were so apprehensive about it because they don't know. Obviously,
True.
it was a very simple surgery for you, but from a patient's or a relative's perspective, it is something
Yes.
huge going through a surgery.
Yes.
So they were literally crying outside, and you went and just like, कि हाँ surgery हो गया, सब अच्छा है, ये 2 दिन में आप इसको घर लेके जा सकते हैं. And they started crying their eyes out, saying, you are. They literally said these words that you are a god to us. आप हमारे लिए भगवान हैं. And this was something that wow, I don't think anyone can get this
that
kind of
that
respect.
feeling and that satisfaction is another level. I know Nothing can get you this satisfaction, the kind of job satisfaction you have in this field. Trust me, you will never have this job satisfaction anywhere. Like saving a life is really next, what do you call, it's one of the greatest thing in humanity.
Yeah.
Okay, when you save a life, so that has really kept me going in this profession, and I've never ever felt that, no, why am I in this profession. I've just
Right.
loved this profession totally.
Which is why I know for a fact that I'm not going to regret this decision 10
Absolutely
years
not.
down the line.
As I've told you in the introduction, that I've known you for 24 years and I've been paying regularly for your football shoes. I'm sure you're going to love this profession and you're really going to enjoy and do your best part.
Thank you so much. So, apart from all the medical life for leaving your profession aside, I know for a fact that you have an amazing social life right
Yes,
now.
true.
But right now, I feel you're relatively free. You're not the student where you have to, be awake for 24 hours or be in a hospital for 24 hours.
Yes.
But I will be going through that for the next few years. So, I just wanted your opinion on how should I maintain my work-life balance for all my friends also who are really worried as to, हर Saturday Sunday party करने नहीं मिलेगा, New Year's गया, दिवाली गया, कुछ कर नहीं पाएंगे. So
True.
how have you managed to engage in social
So,
activities?
I feel that time the social life is not important. Honestly, not important. I remember when I was a houseman, my registrar would knock at 11:30 p.m. on my door, where you've just finished your emergency, just finished your dinner, and like okay, now I lie down for half an hour, and my registrar knocks on the door and says, "Chalo, sabka dressing karne ko," and then he would take me to the septic ward and make me dressings of dirty, foul-smelling legs and ulcers and all and dress. But trust me, Parth, the more sincere you are in the ward, whether you are working for 48 hours or 72 hours, that's not important. This is the part where you learn. This time is not going to come back again. Right now, you are a student, so someone will do an hand holding and teach you. But once you get the degree, no one is going to handhold and teach you. You have become an surgeon then. First of all, you will also have a thing that how can I learn now or from whom should I learn? Right now, this is the age and people are going to teach you. So this is the best time. The more you work, the more you grind yourself, the better you shine later.
Okay.
So I have always loved working. Trust me. Even it was 36 hours, even if I finished my emergency and someone wants to go on a leave and someone wants me to do their locum, I would readily do the locum and do it.
Okay.
But this is a time where you have it's your time to learn. The more you grasp, the better you'll enjoy later on.
Right. Okay. So it's like 3 years of magajmari right now, and then 20 years of
Yes.
maze hi
Yes.
maze hi
Maze, maze. Yes, because once you come into private practice, what type of patient comes to you, you don't have a choice. Unless you have had an experience of handling. Because when you are in your residency, you have to learn what not to do also. Or
Right.
learn from people's mistake or people's, I would not say goof ups, but I don't want to use that word.
I think you can
So
leave out what not to do because
what not. So during your residency you will see surgeons operate and then you have to pick up what is best from each surgeon, you know and once you do that you will give better results to your patient. So for that you have to see many people operate and you have to work hard. I'm telling you, in my when I was a houseman, when we were in municipal, whenever the suture materials and all which is required during the surgery, and if our consultants are washed up and we don't have the suture material in hand to give it to them, boss, you had it. You are out of the OT for 5 days. So all those things, keeping a stock of suture material, keeping a stock of few important things. My boss would always keep a 11 number blade in his wallet. Okay,
right.
because it becomes very handy for dressing removal, suture removal. I mean, not suture removal, a drain removal probably. So there were very beautiful things which are taught by my seniors, and this will no one is going to teach you later on. This is the time to grasp knowledge.
Yeah, I can vouch for that because in my 1 year internship, out of all the departments that I've been to, surgery, the 6 weeks of surgery posting that I had, that was supposed to be the worst, but it turned out only to be the best because I knew what has to be done in the OT, in the wards from you, because of how I have assisted you or how you've taught me how surgery patients are supposed to be treated. Only because I had that knowledge before.
Yes.
It was very impressive for my seniors कि oh इसको तो he's hands on with having gloves, इसको assist करने में पता है कि retractor कहाँ डालना है. So the more attentive you are while the work is going on, or the more hard work that you put in, and they see you put that, you get the fruits as well. It's not only the torture or not the only the grunt work that you're supposed to do.
So all those grunt work, if you have dislike, then you will feel like a grunt work. But as I always tell you, that a good assistant is the one who thinks one step further
Ahead of the
than
surgeon. Right.
ahead of the surgeon. So when you're on rounds and if you feel that okay, my registrar or my one, he will require this,
You
and
got
without
gloves,
he
yeah.
telling you, you keep it ready.
Yes.
That is how it impresses. And the more good work you do in the ward, the better cutting you get in the OT.
Right. That's true.
So your sincerity is always going to help. It's always going to help.
So one point that you brought up was in a government hospital, which I have also seen. In OPDs, you get patients from different walks of life. You have patients who are well read, who are ready to listen to a doctor, and who don't ask many questions and just follow what the doctor is saying. But on the other hand, there are patients who have a list of questions ready for you. Ki why not this? ये क्यों नहीं?
Thanks to
ये दवाई
Google.
कब मिलेगी? Sub, they've all read up before, and I'm sure like in the modern era, there are people who use Google. As soon as they hear a word, they will Google it.
Right.
So I'm sure people come up to you with those kind of questions. Isn't that a little annoying?
It works both ways, Parth. Yes, in municipal, because of workload, you don't entertain and ये दवाई ले लो ठीक हो जाएगा करके, and you don't answer that. But that does not how private practice works.
Exactly.
Okay? In private practice, you have to give a tender love and care along with the medical treatment, because it's like paracetamol is for fever, which any doctors will give, but why a patient will go to a particular doctor? It's only because of the communication skill. I don't think that patients are annoying, but they are kind of misguided sometimes. And I always feel that when the patient leaves my cabin, he should not have any question marks in the mind, even though if it is brought up by Google. Most of the time, my consultation for the problem is in 5 minutes, but the thing which is already registered in his mind, to delete that takes 20-25 minutes. Because, like, for example, if you see bleeding PR, imagine your generation 22-year-old kid typing bleeding PR and what are the causes. First thing pop-ups is malignancy.
Okay.
Now he self-diagnoses himself that he has malignancy, and my note test will kind of say, but then that is the part and parcel of life. But I always tell patients and I encourage them to read Google, but only once I have told them or once it is diagnosed that this is the thing you are suffering. So use Google after a doctor has diagnosed you. I'm very supportive of that. But don't self-diagnose reading Google.
Makes sense. So in a very recent and a very famous movie, Munna Bhai MBBS, which kind of depicts the life of an MBBS student, partly, there is a line where the dean of the medical college says that we are not here to make friends. He's insinuating that doctors should not make friends with patients. But I wanted to know your opinion. Like, do you get attached to your patients, or do you add any sentimental value when you are treating any of your patients? And is it helpful? Should we do that? Should I not?
So the movie what you're referring to, in the same movie, there is Jadoo Ki Jappi, right? Where the budding doctor is giving Jadoo Ki Jappi to everyone and he's making the patient all right, which is very true in real life also. It's always nice to show empathy towards the patient. You talk to them and show some humanity, not being a very professional. I always hear some people say that, okay, Dr. Khadus hai. They talk like this, But I don't feel that should be the case. This is my thumb rule, or this is what I follow, is that any person who's sitting in the patient's chair is my father, my mother, or my relative, So that makes you not go wrong anywhere in decision making. Plus, you are always giving them a tender love and care. Like you will always hear patients saying कि આ ડોક્ટરને તો મળીને મારી અડધી બીમારી ઠીક થઈ જાય.
Huh.
You know?
Right.
So that is the thing which you should achieve. As I told you, paracetamol, anyone who has fever, paracetamol is the drug of choice. But why the patient will come to you to take that paracetamol? It's this communication skills or showing empathy and just being a human.
So that they trust you, basically.
Yes. So you build a rapport and they feel, okay, no, this is the person who is going to save me. If you get this confidence, that confidence will not come unless you genuinely show empathy and talk to them.
Okay, yeah, makes sense. So I just wanted to know, right now there have been very strict rules and regulations against ragging in my college. Ragging is almost completely banned, and it is not like I didn't go through any ragging, and we've all known that there are rumors about how ragging happens in medical college. Like the movie Munna by MBBS, it does focus on a small part where there is ragging in medical colleges. So right now I have not faced any ragging, but in your time, were you ragged at all?
Fortunately, we were the founder students. Okay. So,
What do you mean by
founder students? Founder students, we were the first batch.
Oh, okay.
And the college had started, and we were the first batch to it. So, we never had seniors.
Right.
Okay. And we per se also never liked ragging. So, we had never started this trend since we were the senior most and the first batch. We never ragged the juniors, and we saw to it that our juniors never ragged their juniors. So, it was a fun culture, enjoy, chill with juniors also. So ragging was never a thing.
Yeah, just like that. It's so what we are trying to approach when a new batch is enters is just how easily we can break the ice between the juniors and the seniors. Because I would like to say that more than faculty, it is my seniors who has taught me how to go through medical college, how to approach an exam, how to if I'm too stressed about an exam, how much is the bare minimum I can do just to pass that exam. That only a senior will tell you and not a teacher.
True.
So
these hacks will always
is
be told by a
only a
senior
senior
guy.
knows
Yes.
that. So if you have a good relationship with your senior, that is what is important. So and just to make sure that the juniors know you, and so that they don't it's just basically to break the ice between juniors and seniors. There is no other reason as to why we have these kind of competitions, or you have yeah, just competitions or tournaments, football tournaments where the juniors make a team and they play against the seniors, so that they have a reason to talk to seniors. It's just not that they enter, padhai karo, ghar jao. They should learn how to speak to the seniors, because they are going to be there for 6 years.
True. So, as you rightly said about you getting to know, talk to seniors and during the football match and all, like I had come for your convocation, and whenever your name was announced and people were doing, what were they saying?
What, Hallu bhai?
Yes. So they were saying all Sallu bhai and all. So I'm sure all these icebreakers, as you rightly said,
Yes.
you choreographing and you being in more of these activities,
Right.
does it really help?
Yes, of course. I mean, it was something that I always wanted to like. Dancing and football, I really like both of these activities, and I got a chance to participate in both of these things. I played for my college in many tournaments, and I've won also quite a few. And Saluba is just something very random. I don't even know how that got on, but irrespective, yes, there were a lot of opportunities for me to, and yes, that has helped me also make new friends, meet new people,
And break
and
rapport,
yes,
create a
and,
rapport with
and
seniors, basically.
yeah.
Good. So, how was your journey for MBBS? And right from the first year of anatomy, entering the dissection room, I remember during our time, your eyes would burn because of formalin, and it was like all dead bodies cut open and all and all. How did you feel when you went inside the anatomy hall?
So entering the anatomy hall, we all knew what we were getting into. There were dead bodies, and we have to cut them up. But we were taught very well as to where we have to make the incision, what muscles we are looking at. But first year, everyone, no, not all of us were very sincere, wanted to learn. We were all very excited to just cut and see. So it was fun. People who
But did you or anyone vomit or fainted?
No, I don't think any. There were one or two students who fainted, but it's only because the smell of formalin is very irritating to your nose.
Okay.
The sight of dead bodies never really, made anyone feel the need to puke or anything. We were all ready for that very well.
Because I remember during my time, those who wanted to become a physician or who wanted to go to what we call as a non-cutting line, they would least be interested, and who wanted to go do a surgery as there would be the ones dissecting. And obviously, we all dissect with the respect to the dead body from whom we are learning. But yes, we were all keen, and they would just sit aside and like, अच्छा ठीक है, ये इधर insertion है, ये इधर ये है, कोई
Yeah,
बात नहीं,
yeah,
something
yeah.
like that. So, on the whole, how what do you look at yourself for future, in the sense, once you finish your post graduation, what are your future plans?
So as of now, I have not really thought so much about the future because of how nervous I have been about my post graduation and how the next 3 years are going to look like. But if you ask me 10 to 12 years down the line where I want to see myself is just a very successful orthopedician, of course. That goes without saying. But yeah, I mean, just the feel of operating someone and fixing someone's issues, like you said, is what
Yes.
I'm looking at and what I want to do for the rest of my life. Apart from that, I don't have any materialistic uh, desires that I want a car, I want a house. That all that goes without saying, and as in it'll happen as and when it does. But for now, yes, I'm really focusing on my career, and I want to make the best out of the next few years that I have.
Nice. All set to be an orthopedic.
I guess, I guess.
Good, good. All the best, Parth, and for શું બોલ્યો તો?
Enjoy your journey.
હા. All the best, Parth. Enjoy your journey. I'm sure you're going to love it and be a great, great, great orthopedician, and so that you can buy your own football shoes, and I don't have to pay from it now.
No,
Okay?
I will buy you shoes, hopefully.
Oh, how sweet. Let's see. I'm going to record this and play this after 5 years.